So we're kind of going to move on to the sort of second half of the segment, which is more about the science. And we have with us today the wonderful Lisa Kearns, who is a research orthoptist, a genetic counsellor, and divides her time between the Centre for Eye Research Australia, also known as CERA, and the Royal Victorian Ear and Eye Hospital. She's going to bring us up to date with her work in the team at CERA investigating the translation of genetic eye research, which Mark touched upon this morning, all about the hope, and speak about the research that will be undertaken in Australia as well. So thank you, Lisa.
Thank you. Thank you, Holly and Emily, for putting a great day together. I'd just like to reiterate the words that our previous speaker have made reference to, the importance of continuing eye follow-up for a number of different reasons, so we can monitor the natural history of Usher Syndrome and various other inherited eye diseases, to give hope and to give people the research that's been undertaken by various groups, both here in Australia and internationally. And thirdly, as we know, there's no current treatment for Usher Syndrome. There's a lot of research being done in this area. Things that we can do, and we know that happens with people with RP and Ushers, is the cloudiness of the lens, which is known as a cataract. And so those things can be looked at, and also the swelling at the back of the eye, which can be helped with drops. So there are things that we can do if someone develops that over the course of their vision loss. So today I'd like to bring you the exciting research that's being conducted here in Melbourne at the Centre for Eye Research Australia, and to share with you this research, which may have hope, which will have hope over the horizon. Many patients and families have often described a lonely place when diagnosed with a rare disease. But as lonely as it is, the internet and Facebook have dramatically made it a different world, and we've heard this today from our previous speakers. It opens the door to finding other parents and a sharing of information. Families come together to support each other, as we've seen with UsherKids and the Usher Coalition. The rate of recent progress in human clinical genetics has been astounding. Only 61 years ago, Watson and Crick discovered the DNA, helix, and in 2003 the human genome was sequenced. We've gone from clinical genetic testing to testing just a single gene, to a panel of genes, to potentially now 20,000 genes from a single blood test. Professor David Amor from the Victorian Clinical Genetics Service has indicated that clinical genetic testing is going through a major revolution. And there are many benefits of genetic information. It helps confirm the eye disease, better understand it, more reliably identify other family members at risk, and use new cutting-edge technology to find cures for blinding eye diseases. As made reference to earlier this morning, Usher Syndrome is an autosomal recessive inherited condition where a child has inherited a gene change from each parent. Parents often carriers and usually have good vision and hearing. There's at least 11 known genes thought to be caused from Usher Syndrome. But today I'll be talking to you about the exciting work being done at CERA, and which has seen major breakthroughs for not only Usher Syndrome, but a variety of inherited retinal dystrophies and optic neuropathies. So to understand how cells become damaged and lead to blindness, we need to study those cells and understand what actually goes wrong. And that gives us a way of developing new drugs and treatments. And we can do this from stem cells, which are extremely powerful. A stem cell is a basic cell that can be any other cell of the body. So whether that's nerve tissue, a red blood cell, liver cells, and even an eye cell. So they can be very powerful. And we can obtain stem cells from embryos that have been developed by IVF or in vitro fertilisation and donated for research with appropriate consent. But this, although it gives lots of hope, There have been major ethical challenges and raises difficult questions. However, new breakthroughs brought this debate to an end. So using Nobel Prize-winning technology, scientists have discovered ways to take an ordinary cell, such as a skin sample, and change it into a stem cell. And this opens up exciting new possibilities for stem cell therapies. I work with some very clever scientists and clinicians, and the Clinical Genetics Unit and Neurodegeneration Unit, headed by Alex Hewitt and Alex Pigay, who's sitting up the back today. And we've worked together, we've got a great team, and we've collected over 600 samples from people Australia-wide. Participants have a variety of different conditions, inherited retinal dystrophies, so RP, Usher's, macular dystrophies, and inherited optic nerve diseases, retinoblastoma, which is an eye cancer, and we're taking the skin samples, which can be taken in the outpatients clinic unit. Okay, so we just go back to our previous slide. So this is Professor Alex Hewitt and taking a skin sample from a patient. So it's about 3 millimetres of skin taken from the forearm. Okay. And there are no stitches required for this procedure, just little stero strips or band-aids that go on top and a waterproof dressing. So it's actually fairly straightforward to take the sample, but we allow extra time, obviously, to discuss the project and for informed consent. So from these skin samples, we give them to our scientists who grows these samples, and then we can turn these into stem cells, which then can be turned into either retinal tissue or optic nerve tissue, which is extremely powerful and gets around the issues surrounding embryonic stem cells. Once the sample leaves the skin, there's no blood supply. So the samples have to be cared for like a little baby, okay? So they have to be fed, they have to be watered, they have to be change its little house, and it's very time consuming and labour intensive, okay? So Helena, who's this wonderful lady here, she takes care of the initial skin sample once it leaves the patient's skin, okay? So we could only process a handful of samples in a given week just from the time involved. Often Helena wants to come in every day or every second day, even over the holidays, to process these samples. But in late 2014, we received philanthropic a donation from the Clemenger Foundation, and we were able to purchase Pierre. And he is a cell culturing robot who's able to feed and water these special cells. And so hence we can process and increase our recruitment rate for collecting participants. So it's pretty awesome to watch. And yesterday I was working on my slides, and I brought in my little boy who's almost 5, and the robot got going by Duncan. He was just amazed at how the little straws come in, take out the bad food or the used food, then put the new food in, and then it goes back to its house. So it's truly quite amazing. So you thought 3D printers were all going to change the world, and then comes along this genetic editing technique, which I'll describe to you very shortly. And Science magazine described it as the breakthrough of the year. So what is actually genetic editing? All sounds a bit too hard. Hopefully I can sort of explain it in a basic way that you guys all can understand. So essentially we've got our DNA helix over here, and we've got a gene, which is a spelling mistake in the DNA. And a special molecule, or essentially like a sat nav, comes along the DNA to try and find the gene where it actually, where the spelling mistake is. So just to take a step back, we actually need to know the gene causing the specific condition first, and that's why the importance of genetic testing to begin with. So we have the little sat nav that comes along the DNA to find that gene. Okay, we've found it. Okay, then we have these special molecular scissors that come along and cut the DNA helix into half. So we've got 2 strands, and then we've got technology to actually edit and fix the gene. Okay, so this is actually in the dish, okay, from the stem cell that were created from the person's skin. So it's pretty much putting a new take on cut, copy and paste, essentially. So it's pretty cool. And so I mentioned we've been able to do this in the actual dish for a variety of different inherited retinal diseases. Okay, and so from that we're moving now into the animal work. As Mark was saying, there's a process for how things get developed, and so we've done it in the dish. We're now moving into a mouse model, and this work is headed by Dr. Sandy Boone and Rick Wu, who are the chief scientists working on this CRISPR or genetic editing technique. So what they've been able to do is using applying the genetic editing material into a virus, okay, and then the virus is injected directly into the mouse eye to try and correct the spelling mistake causing the eye problem. And we do know that some genes are easier to fix than others, and it seems that deleting genes is actually a lot easier than replacing a missing gene. So it's truly remarkable and exciting, and certainly the technology that can be used and potentially for the next generation delivery of gene-based therapy. Mark touched on this a bit earlier. So moving on to human trials, we need to make sure the treatment is safe, okay, and it's effective. Okay, we don't want to correct the gene, but give you something nasty. So give you another cancer or have the molecular scissors chop out like other bits of retina. So it needs to be safe and it actually works. And so they're the things that we need to get ready, all the data together to then approach the TGA, which is the Australian equivalent of FDA, to get regulation approval and tick all the boxes and dot the I's and cross the T's. So that's the work that we're moving on to, but it's truly quite remarkable. So Editas is a biotech company in the States, and they have proposed that they're trying to get a genetic editing human trial for 2017 for another type of RP, which is Leber's congenital amaurosis, which is an RP that affects children from a very young age and it's quite severe. So they're hoping to get it by 2017. However, the regulators, so that would be the FDA, so they haven't been approached yet for reviewing the trial, but that certainly would be coming forward, you would think. So if we look at human genetic editing in embryos, China are doing some basic research for this, and the UK have just been given approval to conduct research into embryos, and so to try and understand why some pregnancies progress and others don't. So that's some work that's doing human genetic in embryos. And this is a little girl in the UK who's 1 year old, and she's now in remission following some gene editing of the immune samples. So, which is great work. And there was quite a few documentaries on the BBC. Like with a lot of technology, dotting the I's and crossing the T's, there are some ethical considerations, and some people have felt that it could go too far with human genetic editing and see designer babies or intelligence, eye colour, various athleticism. There's also been suggestion that it could be leading to eugenics and potentially for genetic discrimination. So there are certainly some considerations. So I mentioned earlier that there's significant debate for embryonic stem cells, but there's probably a little work exploring the issue for this human genetic editing, and so we wanted to gauge the public awareness and perception about this form of technology. And last year we had a Monash Medical student, Tristan, and he worked with our group for 1 year, and he and colleagues developed this online survey assessing the acceptability for genetic editing in various different contexts. And so we applied the survey, and it went out on Facebook, Twitter, Google, WeChat to all over the country and even internationally, so it was translated into various languages. And we actually received 12,000 responses from 185 countries, so the picture didn't come through too well, but there's a variety of different countries. We've got Australia over here, and so this is the rest of the international participants, which was truly amazing. And so what we found is that most people agree with genetic editing to cure life-threatening diseases and debilitating diseases. However, there were less support for non-health related purposes such as intelligence, eye colour, sporting ability, etc. So there's dramatic and exciting changes in the development of therapies. I've just mentioned one, which is the stem cell work in genetic editing, and we've heard Mark earlier talk about the various different groups looking at other gene therapies, optogenetics, and people who are more advanced in their course of their vision loss, that bionic eye might be more suitable for them. There are two groups in Melbourne conducting work on bionic eye. There's one through the Eye Hospital, which would be suitable for people with RP and various retinal dystrophies, and there's another type work being done at Monash University, which could be for retinal and optic nerve conditions. A lot of this work does take time, and as you have been able to appreciate, that it does, we need to make sure it's all safe and it actually is quite effective, and it always takes longer than what we anticipate. But 100% guaranteed the improvements at the moment will come from technical changes, which is like your smartphones, the iPhone and the Androids. Even last year we saw a demonstration for a driverless car done on the Eastern Freeway. So technology, just for everyday people, is remarkably changing, and certainly we've got a lot of exciting research being not only conducted here in Melbourne, Australia, but internationally, working very hard to find cures for various different inherited dystrophies, Usher's, RP, etc. So this is our group, and we're made up of different backgrounds. We've got orthoptists like myself, clinicians, nurses, and then we bring in Lisa's group here, who bring in the cell biology and the science. We do have actually a great group that each brings a unique value to it, and so hopefully then if your doctor says there's no treatment on the horizon, you can sort of say, well, I've been to this talk here today, and there's lots of exciting work being done here in Melbourne and overseas, so we can see a lot of things coming on the horizon. So I'd like to acknowledge all the colleagues and the various funding bodies. A lot of this research does rely on money, as you can imagine. And so we receive funding from NHMRC, which is the National Research Group here in Australia, various philanthropic foundations. Of course we could always do with some more, and so we do have philanthropic people affiliated with our group to help get money for research. So thank you.